Hi everybody, I'm Ray, and this is Luna. Say hi, Luna. No? Okay. Anyway, this is like my very first ever vlog, I guess that's what you call it. I had a major life experience that I really would like to share, and maybe I could help somebody, maybe it could just touch them and somebody could have like another experience like mine. My nickname is Rae. It's Rae, and I live in Baltimore, Maryland. And I was diagnosed with a pituitary tumor and hypothyroid in probably like over a year now, probably. My son, he'll be 6, but I've been dealing with it undiagnosed since he was 2. So basically, after I had my son, he was probably about 2 years old when my body started acting all crazy and acting up, and I went to my primary care doctor, but all he wanted to do was do weight loss surgery. That's all he wanted to do. And he's like, he says, you get weight loss surgery. He was like, whatever. He was like, you'll feel better. Everything will get better. You'll feel better. Your body will go back to normal, da-da-da-da, whatever. That's not always the case. I just think, everybody who I know that went to him, he had told them that they all needed weight loss surgery. So he probably has a friend and he gets some kind of kickback or something from doing surgeries or recommending people for the surgeries. So anyway, so then I started going to a wonderful gynecologist. She is really awesome. And let me tell you, she was checking for all kinds of cancers and stuff. And women know, and if you don't know, getting cancer tests hurt. Like, there was the one test that she had to do. It was I called it a barbed wire. I don't know if it's the real terminology. But so anyway, so she went up inside, and I'll just use my spoon since it's sitting here. And it's 1, 2, 3 passes. And it's with 3 barbed wire things. So it was excruciating. After I had got that done, I actually had my, sorry, I can't breathe through my nose yet. I'll get to that in a minute. She did that. Then after I had that done, I actually ended up getting a kidney infection. And when I went back to her, she was checking through my blood work, and she said, oh, she's like, is Dr. Pham treating you for hypothyroid? And I said, no. I said, I just saw him 2 weeks ago. I said, but he never told me anything. And she said, oh. She's like, well, you know what? Let's just be safe. And she says, let's go get an MRI. So she said she wanted to check my pituitary gland. And I said, okay, and so I went and I had my MRI done. Let me tell you, fat people in an MRI tube is not a good thing. It's not a good thing. I was all like this. It was terrible. It was terrible. So if you're claustrophobic and a big girl or boy, MRIs suck, okay? Just so you know. So I had to get this MRI done, and I got it done, and I'll never forget, she called me at work, and she was like, Ray, you have a 4-millimeter pituitary tumor that's wreaking havoc, and everything. And I was like, oh. She said it was benign and not to worry. She said they were actually pretty common. And she sent me to this doctor, this endocrinologist at this other hospital in Baltimore that we have down here. And when I went to go see him, excuse my language, but he was scaring the shit out of me, okay? He was telling me I had to go out of state. I had to go to Philadelphia or Virginia or Florida or somewhere to go to a special brain neurology center to get this tumor taken out. And I'm just like, well, my insurance is not going to allow me to go out of state. Like, what else can I do? He's like, no, you have to go. These are the doctors that you have to go to. You have to see. And he was stressing about how bad this tumor had come out. And I could have sworn it was still 4 millimeters, because I'll never forget the first phone call I got. But my girlfriend who I was with, she said that he said it was 4 centimeters. Now, 4 millimeters and 4 centimeters are two, like, on total opposites of the scale. So, I had to cancel my one appointment with him, but it took 6 months to get back into his office. I'm like, I can't, you know, my medicines, my hydrocortisone, my levothyroxine, my cabergoline, it was also going to run out. So I actually found this new endocrinologist, and she was treating me. And so I had started talking to her about surgery, because that's what the other doctor kept suggesting. And she's like, oh no, you don't need surgery, not with your tumor and this and that. And you know, she kept sending me for blood work and stuff. And then she started taking me off the hydrocortisone, and then she took me off of the cabergoline, but then she raised my levothyroxine. And apparently I wasn't supposed to be taken off of the hydrocortisone. I don't know. It's a big thing. But anyway, so I had just saw her recently, and I went to go see her on a Tuesday. And when I called, because I personally, I don't drive. I'm absolutely petrified to drive. Just me personally, like, I am major phobia of driving. I won't drive. A lawnmower, go-karts, anything I have to control, I ain't doing it. I can't drive whatsoever. I could parallel park, but I can't drive. But yeah, so I was gonna cancel my one appointment and reschedule it, because I didn't have a ride. But luckily my one girlfriend was able to take me. And she because when I called, she said, oh, well, your doctor's leaving. And I was like, oh. So when I went, I had to go, and luckily my girlfriend was able to take me. And when I was there, she says, I looked at your MRI, and she says, your tumor's 4 centimeters. She said, that changes the ball game. She says, I want you to get this steroid as soon as you get it, take it. And I want you to, you know, take it right away. Well, when my husband went to go pick it up, it wasn't ready, so I had to get it the next day. And so I took it on a Wednesday. As soon as I got it, I took it. Thursday, I woke up with a terrible headache. One headache I remember posting on Facebook, like, I don't know what it is about this headache, because, you know, if anybody watches the weather, like, it had rained for, like, almost a whole month down here in Baltimore. And so I was like, it's gotta be the rain, because a lot of people have been having sinus issues and stuff. So my eyes, and I just remember my eyes hurting, like, and I was trying to get ready for a show. I had a show to do on Saturday, and I was trying to get all my jewelry together and, like, get everything staged, and, or, like, you know, everything packed up and stuff. But, like, Friday I couldn't see, like, and Saturday I had to stay home because I could not see. My vision was deteriorating. And I remember Friday night, because I remember I was just so scared, and my husband was, like, reading all the side effects, and he was like, cataracts and vision. And he says, stop taking this medicine now. He's like, you need to call, you know, your doctor. He's like, you gotta get this medicine out of your system. So I tried to let it go out of my system. But when I woke up, something just said Sunday. When I woke up and I couldn't tell, hey, Tigger, something said something isn't right. So I called the endocrinologist and the doctor on call, and they said go to the hospital. Well, I went to, we actually called the fire department, because both me and my husband are volunteer firefighters. I'm on the administrative side, which is fine, but I'm still helping out my community. And we called the medics, and we're like, can you guys come and take me to the hospital? So they came down, and they took me to my local hospital, and they rushed me in for a CAT scan. Well, on the CAT scan, you're not supposed to see the pituitary. They saw it. It was bleeding. And so they had doctors come in, they're like, we have to transport you. And they're like, where do you want to go? And I was like, Johns Hopkins, because hands down, Johns Hopkins, in my opinion, is one of the best hospitals. And I just remember being like, I have white coat syndrome. So as soon as they were talking about surgery and this and that, I am panicking. So they had to give me medicine. All I remember was like the captain of the fire department and the president and like every like members. They like, my room was packed. Like, they're like, you know, this room is a crazy bunch right here. This room is packed. And so they rushed me down to Johns Hopkins. As soon as I got there, again, factor on MRI machine. But luckily I was like halfway out of it because of the medicine. So as soon as I got there, I, got the MRI, and they're like, oh my God, like, you have to go rush in for surgery. Like, I have to get this tumor out, and now. So that's basically what happened, is they rushed me in for surgery because they said, we have to try to save what little bit of eyesight, you have. And here I am. I'm emotional. I have a 5-year-old son. He's going to be 6 in July. All I could think about is my son, not being able to see him. How am I going to provide for him? Just going through the motions. Like, how am I going to take care of myself? Like, my clothes aren't going to match. And, how am I supposed to cook dinner? And how am I supposed to do laundry and walk up and down steps? And, just going through all the motions. So my surgery was 5 hours long. I came out at 3 o'clock in the morning. And, sorry, I keep messing with the computer for more light. So my mom had stayed, so that way when I came out, somebody was still there with me. And, I woke up and all I remember was like how dry my mouth was. Like, I can't stand a dry mouth. And, but the surgery went well. And basically, if you don't know what a pituitary surgery is they go up both nostrils, and they went in through the side of my head, and they pulled the tumor out through my nose, and they, got rid of all the blood and stuff like that. And they were able to restore my vision fully. I have no more blockage with peripheral vision. I could see, like, I could see my hand out before I couldn't see. And that's why I'm like a little nasally still, because I'm not allowed to blow my nose, because they took tissue from inside my nose to plug up the hole. The doctors were like actually really funny, and they're like, yeah, you had a little brain juice leaking, so we had to patch the hole up. And I had like this super duper like elephant tampon in my nose. My girlfriend was so funny because I just had it removed a couple days ago, and she went with me, and she said, oh my God, I didn't know you could get something that big up your nose. But yeah, it's hard because, since I've been diagnosed with the hypothyroid and the pituitary tumor, I've put on a tremendous amount of weight, and I've actually lost like 30 pounds already. And this week, I ain't gonna lie, this week I've been cheating a little bit. I just went through I survived brain surgery. I will eat a damn cookie. I'm sorry. If I want to eat 2 cookies, I will eat 2 cookies. But I got to get back on track. Okay. I mean, I'm still on light duty. I'm not supposed to be doing much. But, you know what? I got to do what I got to do. So, but, people with hypothyroid, they don't understand. Like, outsiders looking in, we look fine. Like, I look fine. I look like your most average heavy-set white girl, But on the inside, people don't understand how I feel. People don't understand how other people that have hypothyroid feel. There's days that people, like, we cannot get out of bed, and it makes me feel like, excuse my language again, a shitty mom, because sometimes it's just so hard to even do anything and keep up with the house and keep up with the chores. And, I'm a member on Facebook. There's 2 groups. It's the Pituitary Support Group, which is an amazing group of people from all over the world. And there's another group with for hypothyroid support. And again, amazing like information. If you don't understand your test, you can post it, and these people will help you in any kind of way. But it's also sad because there's some amazing women out there who have this, and men, believe it or not, who have hypothyroid. And, it's caused issues in my relationship because, nobody understands how I feel, and my, you know, I have no estrogen, you know, so hopefully with the tumor taken out, maybe my estrogen will start producing again, but I have like no estrogen, so I can't produce, you know, like nothing or anything like that. So it's like nobody really truly understands how one person feels, and it's like it's truly an invisible disease. These invisible diseases are killer because, like I said, you look fine, but on the inside you just, like, same thing with depression, diabetes, um I can name a few more, but I mean, like I said, my relationship has hit a lot of bumps in the road because of my health, but I didn't know what was truly going on with me until I was diagnosed with the pituitary tumor and diagnosed with the hypothyroid. And then I got better, but then once my body got used to the medicine, it was like that was it, you know, and I had to, she's trying to snuggle. So I have to like readjust and everything, and it's hard, and it's trying to be being a stay-at-home mom. It's like, there was times that where my husband be like, "What did you do all day?" I slept. That's all I could do. That's like right now it is 3:30 a.m. in the morning. I am awake, wide awake. It's because of my medicine. The hydrocortisone that I take causes insomnia, and I only took it an hour later, and here it is 4 o'clock in the morning, or 3:30 in the morning, and I'm wide awake. Can't sleep. Doing laundry, cleaning up, stuff like that. And I said, you know what? I'm going to make my very first YouTube video. So I didn't really know. In all honesty, I have no expectations. I was actually kind of thinking of making a channel, like a vlogging channels, like Day to Day with Rae, and just kind of take people on my weight loss journey, on my health journey. Like I said, if I could help somebody out there, that would be so awesome. And so just to kind of get things together, and and like maybe maybe I was thinking about maybe trying, like, how you see all the recipes on YouTube. I've actually, like, I've made some of them, but I was like, does anybody really make these? Like, I'm sure they do, but you know what? Let's do Day to Day with Rae. Maybe Rae will make some. I like to make cakes. There's a lot of cake making channels and stuff, but I'm like just a regular, average Joe. I've been making cakes off and on for 4 years, off and on. I make my own homemade stuff, so I said, you know what? Maybe we'll try this. I don't know. Like I said, I'm not really going into it with whatever, but I mainly did want to make this video for people with hypothyroid, saying, I support you, and I want people to be aware of, other people. Life is just too short, and there's so much hate in the world right now. Like, somebody's so quick to judge somebody else because they don't understand how that person feels. They're like, oh, you look fine, you're fine. And I'm even guilty of it with my mom. My mom has a lot of health issues, and I remember growing up like, oh God, you're always sick. Well, that's how I am now. Like, I've been sick for so long that I really don't know how to feel well, if that makes any sense, so and as an adult now, I tell my mom, like, hey, I'm sorry, and I know my son doesn't understand now because, like, I'm supposed to be on light duty, and like I said, I just had brain surgery. My son, he doesn't really understand. He's been, with his godmother, he's been in school, so he just doesn't, understand. All he knows was, ew, mommy's nose was bleeding. Oh, so gross. But that's all he could worry about was my nose. Like, and once my nose would start dripping, like, he would give me a tissue. He was like, ugh. And he's like, Mom, you're gonna make me throw up. And I'm like, well, I'm sorry, sir, but I just had brain surgery, dude. But I could touch base on more about my surgery. I have a whole bunch of appointments coming up with a new endocrinologist at Johns Hopkins Hospital, and I actually see the surgeon. coming up, and so luckily they took 98% of my tumor out. They were able to get that much out. The 2% they left in, they had to, because artery was wrapped around it. Oh my goodness, the cat just walked across the computer. Come on now. It's always something in this house. But yeah, so they said the rest of it can be controlled by medicine. So, oh my God, Tigger, come on, get down, sir. It's craziness. I have 4 cats, so, and I'm allergic to them too, so that's pretty funny. But anyway, I will never not live without a cat. I'm sorry. I love all animals, but kitty cats are my specialty here. But yeah, so the 2% was wrapped around a tumor. They said the rest can be managed by medicine. I actually just got a call from the new endocrinologist, and he said that my cortisol levels were a 10. I don't understand all this terminology, and then sometimes they explain it to me. It's like, can you like dumb it down for me a little bit, because I'm just a normal person. I don't know what the hell you're talking about. So just, but yeah, so like I said, I'll touch base more, and I may make some more videos, and we'll see, what happens, and we'll take it from there. So for now, I'm gonna say good night. Maybe, well, for me anyway, but I'm sure everybody else is probably asleep. And I hope to maybe do another vlog tomorrow and talk more about some things, and maybe I'll show you what I'm working on for my son's teacher for the end of the school year, and I don't know, that'll be that. All right, good night, bye.